Well, good afternoon, everyone. Thank you for joining us for our webinar on supporting student wellness during COVID-19 prevention, testing, tracing, and more. My name is Robin Holmes Sullivan, and I serve as the Vice President for Student Life and Dean of Students at Lewis and Clark. And we are excited about the possibility of having students on our campus again. We've missed them tremendously, and we know that they've missed being here. And for the new students, we know that they're excited about their first year of college. So we have been hard at work on reopening plans, spending a lot of time learning all the different things that we needed to learn about COVID-19 and how we can safely open the campus. We've created an abundance of approaches and plans that we feel will allow us to safely open the college. We're going to spend some time talking about that today, specifically regarding our health-related, mental health, and facilities plans that we know that you all have a lot of questions about. So we have this webinar scheduled to go from 4:30 Pacific Standard Time till about 6. I'm going to ask several of my colleagues to give some brief presentations in their particular expertise area that I think will answer many of the questions that we've been getting from all of you. It's been very helpful to get the questions, to see what's on the minds of parents. What are some of the things that you're worried about? What are some of the things that we haven't communicated enough about that is causing some confusion? What are some of the things that you think we should look at a little bit differently? All of that has been extremely helpful for us. And believe me, we're listening, we're taking all those things into consideration, we're making changes where we need to. And so we're hoping that our hour and a half to this evening will answer some of the questions, especially ones that are thematic that we've heard, kind of over and over and over again. That was one of the reasons why we wanted to do this webinar, so we could get some good information out there and give you opportunities to interact with all of us and to understand the level of planning that we have been doing at the college. We are in the process of planning one, potentially two more of these webinars with the themes or the focus being on academics, because we know that there's some questions that folks have that would be better answered by the academic, the faculty. And so we've talked to the Dean of the College of Arts and Sciences, and he is more than happy to host a webinar in the next week or two on the academic front, so we can get those questions answered. And if need be, if there continues to be questions regarding campus living and dining, we have tentative plans for a third webinar regarding those areas as well. So joining me today will be several folks from our health and wellness teams, including Melissa Osman, John Hancock, and Margaret Upton. And we also have asked our colleague in facilities, Michelle George, to join us, and he will talk a little bit about how the college is preparing to make sure that we are meeting the utmost cleanliness standards and disinfecting that is needed in order to combat this disease. I also want to say that as a parent, I can only imagine the difficult decision that you and your student and your whole family are going through as we learn more and more about this this disease and how difficult it is for us as a country to respond to it. And so I know that your questions and your anxieties and even your frustrations, we understand where that's coming from. We understand why you feel that way. And we wish we could give you all the answers and all the assurances. But the reality is, this is changing for us daily too. And part of the reason why at some point you think, you want to hear from us sooner or, more completely or faster. Some of that has been because things have changed and we had to change our plans, and we don't want to give you information that's not correct. So we continue to do our best to communicate with all of you, but it'll be webinars like this and interactions like we're going to have today that will help us really to shape our messages so that we're getting out the very best information that we can. So again, we want to thank you for taking the time to join us today. We will start off with as I mentioned, some brief presentations in each of our areas that will answer, I think, many of your questions. And then we'll use the ending of our time together to go through several of the questions that we already received from you. But you're welcome to continue to type in questions into the chat. We're going to keep track of those. And if it seems as though there's something that is unique or new in the chat that's not in the questions we received from you earlier, we'll try to get to those answers as well. Do know that this is recorded, and so others can see it, or you could watch it again later on. And at the end, if there are questions that we don't get to, then we will make sure that we post those as well for you. And then the last thing that I want to say is that we recently sent you information about our reopening website that has a lot of information in it. So I hope you've had a chance to look at that. That website is not static. We have updated it twice already, and we will continue to update it. So we really encourage you to continue to look at that website, but we will contact you, as we have been doing, by email when we feel as though there's a substantive decision or something that you need to know about. We'll do that by email. So you'll always know that you'll be in touch with us. So I want to turn first to Dr. John Hancock to have him talk to us a little bit about supporting our students' wellness during COVID-19 and the various approaches that we have been taking so far. So John, will you introduce yourself and start your presentation?
We miss the students on campus. We also miss the personal engagements that we're used to with parents and guardians. So I wish I could see you, but we'll have to do it this way for now. I want to comment on the team that we have here today. And Henry, if you could advance the slide, I will cue Henry to do that. Henry is our person behind the scenes doing the AV work today. So Henry, thank you so much. So I just want to acknowledge that we really do have a wealth of experience on our team at Lewis and Clark. I don't mean to embarrass my fellow presenters, but I think I can easily say we have over 100 years of experience. Isn't that scary, folks? In the college health field among us. I've been in college health leadership for about 25 years now. At Lewis and Clark, I serve as the Associate Dean of Students for Health and Wellness. I'm a licensed psychologist in the state of Oregon and also function as chief psychologist overseeing the counseling service. And then I'll let my other colleagues introduce themselves as we go. Henry, if you could advance the slide. Robin was mentioning the reopening website, and there's a lot of good information there. We'll cover a lot of this today, but I did want you to have that address in this presentation. So these slides will be available as part of the recorded presentation, but that is the reopening website, very easy to find on the college's larger website. If you'll advance, Henry. My team and I have been focused very much on trying to identify what our foci are going to be around health and wellness for students. And our presentation today is really organized in this. I'm going to be talking to start off with about supporting the most vulnerable among us in terms of our students, staff, and faculty. I'll talk a little bit about reentry issues with regards to prevention, and then I'll turn it over to some other staff who will talk about prevention, self-monitoring, surveillance issues, medical consultation and services, testing, and then we'll wrap up with isolation, quarantine, case management, contact tracing. We'll cover all of that, and then I will come back and talk with you a little bit more about some other sort of miscellaneous issues like confidentiality and how that works, and student health insurance, just a little bit about that, and just a few things that didn't quite fit in these categories. But these are the linchpins of our public health approach to supporting students in the COVID-19 situation. Henry, if you could advance the slide, please. So I'll start off again by talking about those who are at most risk and the fact that we are committed to supporting students who are at higher risk of developing severe illness for COVID-19. Now, the list of people who are at most risk does change from time to time. I thought about putting it in the slide, but the CDC guidance changes. I would simply say that obviously, as probably everybody on the call knows, there are a lot of different underlying health conditions that are classified as putting individuals at more risk for severe illness. So I would encourage you to check the CDC website for that information, as it is updated regularly. And if your student is considered to be a person at increased risk and they might need to take extra precautions, please consider contacting our health service staff. Ideally, we want the students to make that call to our health service staff. They can email the health service. There's the email right there. It's health@lclark.edu. Health service staff can engage the student about their needs. And then also our student support services staff, even though this program today isn't focused on academics, those staff can talk with students about what their academic needs might be, and their email is access@lclark.edu. And Henry, if you could advance the slide, please. So another aspect of protecting both the most vulnerable in our population, but also our entire population, has to do with the arrival of students to campus. We want to do everything we can to prevent COVID from ever coming to our campus. We think there's a reasonable chance during this academic year it will visit campus. Given the statistics and the demographics of the population, the transmission rates in the population, we think that it will be coming to campus at some point. We've got lots of precautions and preparatory behaviors that we're engaging in to deal with that. But we want to try to keep it away from campus as long as we can. And so for that purpose, there was some pretty explicit and detailed information that was sent to your students, also Lewis and Clark students, in about the last 10 days or so. And essentially what the heart of that communication is that we want all students to observe a 2-week period of voluntary self-isolation / limitation on social exposure prior to arrival on campus. Now, you'll notice I use the word requirement there. I also use the word voluntary. I say that because we really want as many students as possible to enact this 2-week period of voluntary self-isolation. The issue is that there are a lot of people who have COVID-19 who are not symptomatic. So your student simply noticing their symptoms, whether they have symptoms or not, if they've been engaging socially, that sort of daily symptom check isn't enough for them to know whether they might have the illness or not. So the best way to do it is to have them engage in that self-isolation for 2 weeks prior to coming to campus. However, we want to acknowledge the fact that, that for some students that may not be a possibility. They might have work commitments or other commitments that would preclude them from engaging in that period of isolation. So we do have some alternatives if students can't fulfill that. So how the process is going to work is when students arrive to campus, and these are our residential students in particular, they're going to be directed to do a web-based health screen. And they're going to be asked to attest whether they've completed that 2-week period of isolation. And if they haven't been able to, for understandable reasons, then essentially we're going to be asking them to show evidence that they have been of a negative COVID-19 test. Now, ideally, students will be able to receive that before they come to campus. These tests are of the most help to us. They are of the most interest to us when they're conducted very recent prior to the student's arrival on campus. So what we're saying is if a student is going to not fulfill the 2 weeks of self-isolation, then we would like to have them tested within the 3-day window prior to their arrival on campus. So if they're going to pursue the testing route, ideally they can pursue that before they leave home. Probably, I would recommend, if it's possible, in a rapid testing situation where they can get results quickly. But if that's not possible, if they can't get tested in their home state, their home area, prior to their coming to Lewis and Clark, they can't fulfill the 2 weeks of self-isolation, then we will have testing capacity in our health service on campus, and we'll be sending out communication later in August about how they can sign up for a time slot for that testing. But I want to emphasize the fact that we're really not set up to do testing at this point of all students. And so really the very, very best strategy is to have students do that self-isolation period at home for 2 weeks before they get to campus. Now, you'll notice there's an asterisk on this slide. And if you'll excuse me for just a second as I manipulate things around my screen here. The reason for the asterisk on this slide is that there are some slightly different rules that apply to students who are arriving from international travel. And I'll talk about that a little deeper into my presentation. So as this slide mentions, we want students to engage in that 2-week period of self-isolation. And then also we want them to practice healthy habits to limit the spread of the virus during that time period. Henry, if you could advance the slide, please. It is important to note how we're defining self-isolation, and this is straight off the college's webpage. So self-isolation in this context is defined as staying in your place of residence to the fullest extent possible for 14 days prior to arrival on campus, limiting contacts with those outside your immediate household, minimizing any travel from home, except for essential trips, such as to work, doctor's appointments, and to the grocery store, and in all of these, adhering to social distancing protocols. Next slide, Henry. We do want our students to limit social contacts and exposure to others. And if you are in a home where the others you live with are not self-isolating, we really recommend and want students to minimize close contact with those people by avoiding situations where they have face-to-face contact that's closer than 6 feet for more than 15 minutes. Students should be especially asked to avoid attending large gatherings, social hotspots, and absolutely avoiding those where social distancing cannot be maintained or where face coverings would be optional or not effectively practiced. So if they're going outside for social events, we do not want them doing that. And then also overnight trips and non-essential travel should also be curtailed. And all of this, again, is on the website. Also during that period of self-isolation, we want them to be wearing masks. They're going to be doing that on campus. Melissa will talk about that in a little bit. In public areas, they'll be doing that on campus in classrooms. We want them to be maintaining 6 feet of social distance from others. We want them to be monitoring themselves for symptoms of COVID. That includes monitoring their temperature on a daily basis and seeking medical advice if their temperature ever rises above 100.4 degrees Fahrenheit. Of course, washing hands often, soap and water at least 20 seconds. A lot of these things probably are very familiar to all of you. And disinfecting high-touch areas in the home with wipes and disinfectant. Next slide, Henry. This slide, I think, very basic about covering coughs and sneezes, about using their own toothbrushes, eating and drinking utensils. These are all the things that we want them to be doing during that 2-week period before they arrive on campus. And so I'll just give you a second to finish reading the rest of the slide before I move on. Okay, and if you could advance, Henry. So a question that's arisen to me about the 2-week period is, if I travel to campus during the 2-week period, doesn't that sort of break the self-isolation period? And we know that students from Lewis and Clark come from all over the country and all over the world. And so what we're wanting really is for them to enact 2 weeks of self-isolation. And we know at some point they're going to need to travel to campus. When they travel to campus, we want them to follow the CDC recommendations for safe travel. You can find those recommendations for safe travel at this website. A lot of them go parallel to the recommendations that I've just reviewed. If students keep that 2-week period of self-isolation and then travel in accordance with the CDC recommendations for safe travel, they have not sort of broken their self-isolation period. So it's okay for them to fly to Lewis and Clark, fly to Portland, or take other transportation means to Portland. That isn't breaking their self-isolation period. We just want them to be safe when they travel and to have that 2-week isolation period before arriving on campus. And then, as I mentioned earlier, students arriving to campus following international travel should definitely rely on information received directly from the LC International Students and Scholars Office, because they will have a little bit of additional guidance for those arrivals. Next slide, Henry. This might seem really simple, but it's really important what to pack. This information was sent to students last week. there's a lot of things that students are going to need in these times that may not seem apparent. So, you know, we're going to be working to help students have access to these supplies on campus. But for example, something that we need your help with is reusable thermometers. So we want all students to come to campus with a reusable thermometer. A lot of them have batteries. We want them to bring extra batteries with them because we'll be expecting them, even when they're on campus, to be taking their temperature each day so that if they do have a temperature at any point, they can seek medical consultation and isolate themselves as their very first steps. You'll see other items on this slide of things to pack. And if you'll advance the slide. You know, there are some things on this slide that you might not otherwise think about. Again, all of this information on our website. Why would John put laundry detergent on this website? Well, I'll tell you why. And that's because if there was a situation this year where a student would to test positive for COVID, let's say one of our residential students, and let's say they had a roommate. As Melissa will talk about after a while, there's a really good chance that roommate would be assisted in getting into a quarantine living situation as soon as possible. And in that quarantine living situation, they're going to need access to some things to sort of be somewhat self-sufficient for a period of time. Now, of course, not entirely self-sufficient, that's probably the wrong word, because they're going to get a lot of support from people at the college. But having things on hand like laundry detergent, facial tissues, you know, prescription medications, right? Their mobile device or laptop, the kind of things are on this packing list, will be really helpful to them if they should ever have to go into an isolation or quarantine situation over the course of the year. So that's why these things are on the list. And if you'll advance, Henry. And I'm going to turn over to Melissa Osmond, our Associate Director for Health Promotion.
You're muted, Melissa.
Thank you. Do you think I'd learned this by now? Hi, everyone. My name is Melissa. I'm the Associate Director for Health Promotion. I have a master's degree in public health and have worked in college health for 16 years now. Before that, I did work in Haiti, doing women's health care and international health. When we're not dealing with COVID, our office addresses a lot of issues that students face in college: substance use, stress management, sexual and interpersonal violence, emotional self-care, infectious disease, which is what we're talking about now, and travel health and safety, among other things. But since we're talking about COVID today, I gotta look at my notes here, hold on. So we have a campaign that we're approaching this by two ways: prevention and surveillance, and then the other piece that I'm talking about later is the case tracking and contact tracing and case management. So we want to stop it before it starts, obviously. We want to make sure that we have as few cases as possible on campus. So we are employing a campaign that we're calling We Before Me, and this slide, the We is before me did not get changed. It's We be capital B for me. The basic strategy is holding each other accountable for doing the right thing, for setting behavioral expectations, and making sure that we're all doing the same thing. If you look at the college's website, the reopening plan, there is a front and center a link that says expectations for the entire community, and we really mean that. So we are going to be using strategies, a lot of positive health messaging around hand washing, health etiquette, face coverings, and encouraging people to wash them. The students are going to be receiving 2 face coverings when they arrive. That's why we encourage them to bring some more, so they have one prepared probably each day, and then wash them in between. Social distancing, we want to make sure that people are maintaining 6 feet, and if they can't, have face coverings on. Self-screening daily. We will have a self-screening tracker on our, which I'll talk about later, but we want students to daily take their temperature, check their symptoms, and report any symptoms to us as soon as they have any symptoms whatsoever. We have no visitors on campus. And one of the other things we're going to have in place is community health ambassadors. We're going to hire students to help us spread the message, peers, encouraging other peers to abide by the social norms, the new social norms of this day and age. And somebody asked me recently in an email, what about students who don't comply with these things? We know that students are at a certain age, or sometimes they don't necessarily think about other people, or they don't necessarily maybe forget to put the mask on. We have policies in place that will help students abide by policy, and mostly it's going to be educational in nature. If somebody forgets their mask, we'll just ask them to put it back on. We hope that the community itself will police itself. But if there's anybody blatantly endangering the community by not complying with these expectations, there is a process through our student conduct process to try to educate them about the importance of following through with their expectations. And if someone, again, is blatantly endangering the community, the consequences will be more severe. We don't want that. We don't want people in our community that aren't going to take care of ourselves. So that's a slide. Surveillance. We need to keep track of what's going on in the country and in the locality and on campus. So we have been monitoring the situation since day one, national and world local trends on how this disease is unfolding, how it's transmitting, where there are hotspots and where there are areas where people are having some wins, where the case counts are going down. We want to take a look at those and figure out how can we take that information and use it to our benefit. And we are collaborating very closely with local public health authorities, including Oregon Health Authority and Multnomah County. We have a liaison with a higher education entity here and the state and the county that we worked very closely together to have protocols and guidance that is updated as soon as the CDC and other entities have it coming down. Sorry. So system tracking on campus. So we have an electronic health record system on campus we use through our health service and our counseling service and health promotion office. We have a means to track student symptoms on campus. So I mentioned daily health checks. If a student is ill or having any certain symptoms, they must report the symptoms to the form on the student health portal, and that will alert our health services to reach out to those students and find out if they need testing or not, and follow them to determine whether they have COVID or not. And if they do, we will implement self-isolation strategies and quarantine, which I will talk about more later. With this system, we also have an ability to figure out where they are on campus, if they're on campus students. If we have certain people that are sick and we see they're coming from a certain residence hall, we can put appropriate mitigation efforts in place, and also notifications if appropriate to the halls. I think that's my last slide. Yes, Michelle, I think is the next person to speak.
Great. Well, thank you. Good evening, everybody. I'm Michelle George. I'm the Associate Vice President of Facilities. I have a degree in engineering and architectural design, degree in English and philosophy, a master's in management, and a bunch of other certificates. I've got about 40 years experience in higher education, and I've worked for 8 institutions, primarily small liberal arts colleges, some of which you know, some of which you may not know, around the country. In terms of our facilities, everything we're doing, we're following the state of Oregon and CDC guidance for facilities operations. We're making sure we do that. We're quite often going above and beyond where they want to go. And we're really focusing on resilience. And you'll see some of it as I go through, but for an example, if your child is here at school and facility staff get sick, you say, who's going to take care of them? We actually have backups. We've got contractors and other people lined up that we're training so that they can come in and actually maintain the buildings and do the work for us should we lose some of our workers. Same thing for custodial staff. So we're looking at that. I have one slide with 3 articles on it. I'm going to go through it. There's a lot of stuff. So I'm just going to go through it at the high level. And hopefully you'll get a flavor for what it is we're doing. All classrooms and modifications, we've modified a lot of space. All our classrooms have been reconfigured for 6-foot spacing. And we've calculated so that the state currently allows 25 people in a classroom. They're designed so that we don't go over that. We include the faculty member in there. So we've made sure that the classrooms themselves are safe, that the student going in has the spacing they need and they're wearing it. We've created some outdoor spaces. We have tents for some classes and for socialization. We have 7 going up right now, and we're looking at a couple more. We're also in the process of completing 3 outside pavilions. These are new structures. They're going to hold approximately 4 or 5 students where they can just sit, congregate, meet with faculty, do it outside. And we're also looking at converting 2 former bike shelters into the glass structures into outside space so that, again, students will have spaces to go outside. We're looking very closely at our outside areas. We've got a number of overhangs. We're getting Adirondack chairs so we can sit them so that students can sit outside by themselves, covered in the winter, and kind of safe. We've gone through all the buildings, major buildings on campus. We have delineation of traffic flows that say you enter this way, you go this direction, so that we can make sure people aren't crossing paths, so that they're minimizing their contact. We've deloaded furniture in a lot of the lounges and the residence hall common spaces so that we can make sure the students follow the social distancing requirements. We're reconfiguring our dining facility to make sure that we have adequate separation from everybody. We've got plexiglass shields going up where we need to, and we're making sure that, again, we follow the state guidelines on it. We're installing plexiglass and solid panels in areas where people would have contact. So if they go to pay a bill or if they go to talk to the registrar, they'll be protected. Both sides will be protected by plexiglass shields or others. We're closing the college to outside visitors so that it'll only be open to inside to make sure that we don't have people from the outside coming on, bringing contamination with them. We're reconfiguring the shuttle so that it actually has less seats, but it will be safe. And we're changing the route. We're reducing it slightly, but we're also making sure we do more runs down to the local pharmacy, grocery store, so that students can have access to the things that they'll need. And the bus is being cleaned after every loop. We delivered face masks to everybody on campus. We'll provide them to students. We'll also have spare face masks. So if somebody loses a face mask or gets damaged, we'll have the face masks. In terms of cleaning, we have a new contractor. He's currently training all staff on COVID cleaning, so everybody will be trained. And they're following, again, CDC, and it's a good clean program. We're increasing the frequency of the cleaning. We're going up to a lot of spaces that we're doing double cleaning, triple cleaning. We're sterilizing common surfaces, tables, chairs, door handles. We've got 6 electrostatic misters backpack, and we've got 6 more on order so that we can actually go in and kind of use a cold spray on things so we can cover. We'll do that at night in the common areas and the activated areas. The other thing that's really good at is that we can leave soft furniture in space. It'll actually disinfect soft furniture. Otherwise, a lot of places are pulling out the soft furniture and just leaving hard furniture for everybody to sit in. So we will have the ability to disinfect. We're providing hand sanitizers in all classrooms, common areas and spaces. We're providing wipes or spray bottles for sanitization in most spaces. We're also, our computer labs are being cleaned after every use in the computer. We've got our computer staff working on that. Dining, we have enhanced cleaning of the tables. We'll be going through in the middle of the day using the electrostatic cleaners to kind of clean everything. The tables will be marked. So when somebody leaves, it'll be marked not clean. And then when they've cleaned it, they'll actually mark that it's a clean table. And they'll have ambassadors walking around to make sure the table's clean, to help students find seating and to help them get whatever they want. We're also developing custodial ambassadors. There'll be at least 1 on each campus. There'll be 2 on the CAS campus, which is the campus your child will be at. And they're going to have a responsibility of responding to emergencies, doing additional cleaning, following through. If there are things, we hadn't anticipated, they will be the ones that will be there so they can be there instantly. They're highly trained so they can use all our equipment, so they can use every piece of equipment we have. We also have a specially trained custodial team. In the event that we do have contamination of COVID area, they're trained and they have all the protective gear so they can go in and completely sanitize the area. So we're set for that. We're also looking, resilience is one of the things we're looking at to make sure that, as I talked earlier about having backup, we're finding that getting products is difficult. So we're currently securing a 3-month supply, which is a whole semester of things like cleaners, sanitizers, wipes, and products like that to ensure we have enough. The supply chain goes up and down on that. So at this point, we literally have 3 months, a whole semester's worth of cleaning supplies. We'll continue adding to that as we go on, but the general sense is that we want to make sure that we're not vulnerable and that your student isn't going to be exposed. In terms of the mechanical systems, all the residence halls have operable windows. We don't have central systems in the space, so they have operable windows they can open. They have heaters, radiators, so they don't have to worry about blowing air around the space. Bathrooms, exhaust systems are being set to, they're 100% exhaust currently. We've got a couple with heat wheels in, we're setting those so they'll exhaust 100%. So all bathroom air will be completely vented to the outside. We're cleaning buildings 7 days a week, and then quite often multiple cleanings in that time. In all major academic buildings where we have major central systems, we've shifted the operation so it's 100% outside air, which means that the air that's coming into the room is directly brought in from the outside, and the return air, the air that's exhausting from the room, is vented to the atmosphere. We won't do any recirculation of air, so we'll actually have all new air into the spaces. All our air conditioning systems, because they were shut down for the summer, we didn't have students here, have been checked. We make sure we don't have Legionnaires' disease or any other kind of things that get in those systems. Water systems, we had very few people in the residence halls for water. We've checked them all out. We flushed the systems out, and we've done checking to make sure, biological testing to make sure that they're clean. All the air handler filters have been changed recently to make sure that those are gone. Drinking fountains are shut off except for bottle filling stations. So the only thing we will have available are the bottle filling stations to ensure there's no contamination. We've also checked the operation of all windows and screens that are operable to make sure they'll be working. So those are just some of the highlights of things we've done, but we've been working pretty hard. We will continue to work and make changes as we go on. We're looking to improve everything we do to make sure that the campus that your child comes to will be safe. Thank you.
Thank you, Michelle. Margaret, I think you might be up next.
Hello, I'm Margaret Upton. I'm a family nurse practitioner and the current director of Lewis and Clark Health Service. I've been in college health for over 20 years, and I have functioned as a health center director for over 12, with the last 3 being at Lewis and Clark. This slide tells you a little bit about our routine services. Some of this will be altered related to COVID, but I did want you to know some of the services we do regularly when we don't have an outbreak. So all of our services are confidential. We are FERPA based, as well as we try to adhere to HIPAA confidentiality as well. And we serve all students, not just students that are residential. So any student is welcome to come, whether they have our student health insurance or not. Typically our services, none of the provider visits are for a fee. There are some fees for laboratory tests, medications, and that type of thing, but all visits themselves are without charge. Things we do, we evaluate and treat illnesses and injuries, physical exams. This is one area where we probably won't be doing a lot of these this fall, with general physicals. Laboratory services, we do have laboratory services in-house. And we also refer to a reference lab, which is currently Quest. Prescriptions, we do have small in-house prescriptions, so students don't need to go to the pharmacy. However, we do e-prescribe, and that goes to our local pharmacies, either at Fred Meyer or Safeway typically, but we can do a Walgreens, we can do CVS, whatever works within your network. Students do have access to get to Fred Meyer and Safeway, and they also, if they sign up, they can get their insurance there, and things can be delivered to them as well. But that you need to check with Fred Meyer and Safeway. We do travel consultations and vaccinations. We will continue to do vaccinations. We do measles, mumps, and rubella, and meningitis, hepatitis. So there are vaccinations we will continue to do. Travel consultations, because we are not traveling abroad in the fall. We probably won't do that, but that will resume when things calm down and travel is allowed. We do referrals off campus to specialists, radiology, and therapies. Next slide, please. So services for this fall, the things that have changed, they actually changed in the spring, and some of them are continuing, and we're adding some new ones. We did transition to telehealth visits for initial contact. That protects both the student and our staff members to find out what their symptoms are. A lot of things we can do via telehealth without having in-person visits. But obviously, we can't do everything via telehealth. Therefore, we do have, once the telehealth visit, we will have separate clinics for ill students as well as well students, so that they don't have the mixing. We don't want our well students to be exposed to ill students where they could be contaminated. So with that, our normal clinic, which is in Templeton, the lower level, we will reserve for our well person visits. We newly have established a Hartsfeld clinic, which is in one of the dorms for respiratory or sick type visits. And that location is right where the isolation area will be for students who are testing positive for COVID, as well as adjacent to the quarantine facilities for those who may have been exposed but are not showing symptoms of COVID yet. So COVID-19 testing, we anticipate getting point of care testing for molecular COVID testing, and we think that will be there at the latest by the 1st of September. We're hoping that will be earlier. We also do send out for COVID-19 testing as well. Billing structure for that, we really would like to have students submit their insurance information for our reference lab. They will bill the insurance directly, but if not, we will give the student the receipt that they can then bill their insurance. Turnaround times currently for our reference lab are long, but we are working with other partners in the local community to try and get PCR testing in a shorter time frame. We will be having influenza clinics this fall. We do have a supply that we reserved last January. We know that won't meet the needs for all of our students. So we are contracting and working with an outside vendor to have other clinics on campus. Normally our hours are Monday through Friday. but this year we are planning to expand to some weekend hours. We haven't determined exactly what that will be yet. It depends on some staffing, but we don't feel that having students go 2 days without access to health services is appropriate for this fall. Next slide, please. So our staff, currently we have 2 full-time nurse practitioners, 1 part-time internal medicine physician, 1 RN, laboratory technologist, and 1 administrative assistant receptionist. And all of the staff have been in college health for at least 10 years. Currently, we are also expanding our on-call capabilities. We have 1 nurse practitioner now and have other practitioners that we're trying to expand and potentially hire an additional nurse practitioner to cover the needs that we may have with the additional demands of weekend coverage and an additional clinic. Next slide, please. As Melissa has mentioned, we will have students utilize the health portal. The students should have already been introduced to this as they're completing their health histories and immunization requirements for entry to Lewis and Clark. This will also be used for mobile self-check-in. Our process this year, we will have students check in before they actually come into the clinic. We are trying to minimize the time in the clinic and the exposure to other individuals. So we will have them self-check-in and then direct them into the clinic for their appointment, and then have them leave through another door in our respiratory clinic. We will be needing to do symptom screenings for students, and that is on the health portal too, as Melissa had mentioned. Next slide, please. So we are not 24/7 clinic, but we have set up some systems for students to get some help 24/7. We do have a nurse consultation line for when our clinic is closed that students can call and get their health questions answered and directed of what they should do. We also have some local urgent cares that have extended hours. 3 of the ones that are in Lake Oswego, which is the closest area to Lewis and Clark, a Legacy, a Providence Express, and an AFC clinic, and they all do COVID testing. For students that may need care beyond what we can provide, we do have Oregon Health and Science University within 6 miles or less than 6 miles of campus. We work really well with them, and they are a teaching hospital. So that's usually where we send students. There are other hospitals, emergency rooms in the area as well, but that is the closest. We are working on transportation for ill students. Currently, students can go with another student, but we realize that with COVID, that could be problematic. If they are very ill, we do have emergency services that come very quickly when our safety and security call for backup. So students can get to facilities quickly. And we do have a plan to help with some urgent care things that we are working on. Next slide, please. So for contact information, I think they addressed our health@lclark email. I wanted to also give you the website, which has some COVID information on it, as well as our phone number and fax number if you have other questions.
Thanks, Margaret. And as a reminder, these slides will be available so you can find all of that website information after the presentation as well. We're going to circle back to Melissa. She's going to talk a little bit about isolation, quarantine, case management, and contact tracing. Melissa?
I muted myself now. So, yes, lots of questions about what will we do when we have a case, and we acknowledge it's only a matter of time. When students, we want them to contact us with symptoms. If they're tested or they're actively ill, we will move them to some rooms set aside in Hartsfield Residence Hall for isolation. It's on campus. It's for on-campus students. Margaret mentioned that there's a clinic on site, so there'll be daily check-ins with the students there. We'll have food delivery. Food service will deliver food, and there will be support for academics. Students will stay there as long as they need to, be that and if they're when they're released from the healthcare provider, or if they need other care, then they will be transferred to other care. For students who have been exposed to known and expected cases, for instance, a roommate of a student tested positive, most of the time the roommate will be moved to like the quarantine area. In some cases that may not be necessary. It depends on the room and structure, and if the roommate was never around when the exposed for the case was there, then they may not have to go to quarantine. But most likely roommates will go into quarantine and other close contacts as well. Separate hall again, they will be there for typically 14 days. There'll be regular check-ins by case manager and health staff to see if we're going to ask them to check their symptoms regularly and check in with health staff and case manager to make sure that they're supported. And my office is managing most of the case manager duties in this case, making sure that they have non-medical needs attended to, such as food delivery, connection to the support for academics, if they need to have other appointments that they need to make on campus, if they need anything that we help support them in their isolation and quarantine. We'll do that. Next slide, please. So case management. I see this as two-tiered. For active cases for people who are ill, the health service will be checking in on them daily to make sure they have everything that they need medically. For non-medical needs, our office will be working with health services and other offices on campus to make sure that they're connected to anything they need that's not medical related, such as food and laundry, for instance, and connection to student support services for academic support, IT, if they need to, if they're well enough to do coursework, that they have everything they need in the situations. Contact tracing. Now, most counties in the United States, and especially in Oregon, have their own contact tracing set up. This is not taking the place of that. We're supplementing that. We're focusing just on the LC community, and so we will only be contact tracing people who are part of our community, not necessarily out the community. We'll leave that to the county to do. Notifications will be made appropriately and as necessary, and John will talk more about that, and I think in the confidentiality piece of things. And the expectation is when we reach out to your students, the expectation is that they'll respond to our outreach. Just as the expectation is that if they are ill and having symptoms related to COVID, that they are contacting us and letting us know. That's the only way we can mitigate this. And yes, so please encourage your students to contact us. And moving on.
Thanks, Melissa. And I think, John, you're going to talk a little bit about mental health issues, insurance, and things that parents can do as team members, us all in this together, that would be helpful.
Yes, absolutely. So I do function as chief psychologist when I'm not overseeing sort of a lot of our wellness-focused response to COVID. I want to talk a little bit about the emotional well-being of our students. We know this is a huge issue. It's been a huge issue for decades, if you will, and absolutely in the last decade. And especially with all the stress of COVID that students are experiencing, and there are all kinds of stress and stripes that takes. Every listener on this call has been touched by COVID in different ways, whether it's by loss of employment, or a family member who's been ill, or any number of other situations that might have arisen. We also know that COVID has a disparate impact across socioeconomic levels in our country for American Indian, Alaskan Native, Black, Latinx individuals. They've not gotten the access to healthcare that they need. So all of these issues come together in a situation where both COVID-related and non-COVID-related stress have been really at very intense levels. So we do have a robust counseling service. We focus on providing confidential, brief, free counseling to students. We'll continue to do that this fall. Primarily, we'll be doing telemental health services this fall. The reason for that is because to have a counselor, and a client in the same room for the better part of an hour and if there's only 6 feet distance and then we have to have masks on, it creates a very difficult situation. And what we found in the spring actually is that we can provide telemental health services to students where masks are not necessary. Counselors can read the nonverbals of the student that's talking with them because they can actually see their face. Students have found it very helpful as well. So we will be offering primarily telemental health services this fall. All of our providers are either licensed mental health professionals, primarily psychologists, but we also have a licensed clinical social worker on staff. We also have graduate trainees who are doctoral students in training, or in one case, a student who's in training for their MSW degree. So we have lots of different stripes of mental health professionals, also a part-time psychiatrist who works with us as well. Not only do we provide counseling to students, we can also provide consultation to them. So let's say they're not struggling themselves necessarily with a stressor, but they're concerned about someone else who's struggling and they want to get help for how to help their roommate or how to help a friend or even how to help a family member. We can offer that kind of consultation too. When the counseling service is not open, like the health service, we offer a 24-hour crisis line that students can call so they can always get help. And we do programming beyond just the confidential counseling that we do in the counseling service. So there are a lot of links on our webpage to apps that students can access, especially in these difficult times. So apps around mindfulness, apps around meditation, apps for other things. We do mindfulness programs themselves for students, and we're still developing our plan for the coming year for other outreach efforts. Not in the counseling service proper, but in another department of campus, the case management office. That office specifically focuses on helping students find referrals to off-campus resources and on-campus resources too, often to mental health resources, but as well as to other health resources, not just mental health. So that's a really great resource too to support students' emotional well-being. Next slide, Henry. So I'm going to, I don't have very many slides left, and then we're going to get to the Q&A part, which I know everybody's eager for. I do want to talk about a few things, though, before we head in that direction. One is about confidentiality issues. So students have confidentiality rights as adults in the legal system and in the healthcare system. Even 17-year-olds have rights of privacy in the higher education setting. So a few of you might have 17-year-olds that you're looking to send off to college. So there are a lot of privacy rights that students have. My wellness staff and I, we need to honor those rights. And we find that by honoring those rights, students come to trust us. So I've had parents be in touch with me already this summer, and they said, John, we want our students to sign a release so that we can know whatever is going on with their healthcare because we're really nervous about what might happen, and maybe they get COVID or this or that. And my response to parents has been to absolutely talk about that issue with your student, and actually absolutely talk with your student about your interest in knowing what's going on with their healthcare. But the challenge is if you sort of pressure or coerce a student in a certain way, they feel coerced, maybe you didn't intend it that way, but that's how they feel it, to sign a release of information form that gives you the right of access to their healthcare information, they actually might be less likely to seek care for something that's sort of sensitive, like a sexually transmitted infection, or like suicidal thoughts, or like other concerns that they just want to keep very private. So what I say to parents is that when students come into our clinics, we will talk with them. First of all, we'll engage them in providing the very best care we can. When it seems like it's appropriate for us to be engaging a family member or guardian, someone like that, in their care, we'll talk with the student about signing a release to do that. And then they can sign the release, and that allows us to engage family as appropriate. Students do have the right to revoke a release at any time, and so, you know, the other issue with sort of pressuring students to sign releases in advance is that students can come into our office and they can actually revoke the releases, and so that's a difficult situation too. So we will do our best to honor confidentiality issues with students in accord with medical privacy law of Oregon, and to engage family with the student's involvement whenever it seems appropriate. Now, I know there's a lot of anxiety about COVID and what communication might happen with family about those matters. So diagnoses related to COVID, symptoms related to COVID is protected health information. And so we're going to be managing that information like we handle other confidentiality issues within the health service and the counseling service and the health promotion office. In fact, the public health people will be managing it that way too. So for example, COVID-19 is a reportable public health condition. We have to inform the public health officials about it. But when we do that, you know, we're going to be very, very careful and very sensitive, and public health people are going to do the same thing about who is informed of what information. And generally, information is going to be held pretty tightly. So, so that the identity of a student who has COVID is not going to be released to the community. Rather, we will give much thoughtfulness to how we will communicate with the community about community members, about who might have been at risk as a result of a student who tested positive, and what information needs to be given to those parties. So we're absolutely focused on public health and the health of all community members, but we're going to do that with extreme sensitivity to the privacy and the identity of anybody who is a confirmed case. And we'll be doing that with students and with family as well. But again, this is why I recommend that you talk with your students about your interest in being informed if they ever have symptoms or if they do test positive, because all the student needs to do is sign a release, and we can engage family and guardians and talk with them about those issues. The last thing on this slide that I want to mention, I know there are a lot of questions about testing. Margaret talked about it earlier. Again, we have been focused on getting access to rapid testing equipment, point of care testing. We feel very positive about our ability to acquire that equipment by September 1st. We've also been exploring relationships with additional labs off campus that would allow us to decrease the turnaround time on any external testing that we do. We're also giving very serious consideration to surveillance testing. You know, the CDC recommendations and the Oregon Health Authority recommendations actually have been to not test all students when they come back. They don't think that's a wise investment of resources. And we've taken that under advisement, and so that's the reason why we came to our decision about really recommending that 2-week self-isolation period before students come back and not requiring mass testing of all students before they return. However, I do want to let you all know that we are being thoughtful on an ongoing basis and paying attention to all of the markers in the public health arena about plans for sort of testing of both symptomatic and asymptomatic students throughout the fall, and what that might look like for our campus. So as we continue to develop those plans, we'll be sure to keep everybody posted about those. Next slide, Henry. Health insurance, I won't say much because I want to get to questions, but I do want to say there's going to be a webinar. It's the bottom line of this slide. On Friday, this Friday at 4 o'clock, where I'll be talking about health insurance issues. All of our students need to have health insurance that works wherever they're studying, whether that's in Portland or their home, if they're remote learning, or if other semesters might be a study abroad program. They need to have health insurance. They're enrolled in that health insurance automatically. It's easy to get out of it if you have alternative insurance. September 14th is the waiver deadline this year. So just be sure that you've talked with their student and either you're good with them being enrolled in our student health insurance plan, that's great. Or if you don't want to be enrolled in that plan, just be sure they get the waiver completed by the 14th. Otherwise, they will be charged for the program for this year. For more details, attend the webinar on the 31st. A last word about Kaiser coverage. If you've got Kaiser coverage, Kaiser facilities are actually quite a ways from campus. So I encourage you can go to that website at the very top of this side called trimet.org, and you can map out how far a Kaiser facility is from campus and what it's like to get there. So if you have Kaiser coverage, that does satisfy our waiver criteria for health insurance. So you can keep that and you can decline our student health insurance, but it just might be more difficult for your students to access that coverage at Kaiser if they ever need to. And next slide, Henry. Okay, so what can you do in the coming weeks? So as I said before, you can familiarize yourself with the webpage. We know that not all of your students are going to be painstaking about reading every page of our reopening webpage, but it would be a good idea if they did. Anything you can do to be familiar with our webpage and help sure your student reads through the webpage would be very helpful. That issue of the 14-day isolation period is not going to be easy. It's not fun to stay in isolation or even to significantly limit your social contacts for 14 days, and that's what we're asking. So we ask for your help in helping students kind of keep that 14-day period as intact as possible. And again, if they're not gonna be able to do that, we understand there are some students who are working in situations where they can't do that, then we can talk about testing options for them. Of course, support students with the health behaviors we previously outlined, so help them with their packing list, help them get that thermometer. In fact, honestly, I would help if it was my son or daughter, and I've got a son who's returning to college this fall, I would help them actually to take their temperature, kind of make sure they've got the technology down about how to do that for the week prior to their coming back to campus, so they know how to do that, and there are no issues with technology. If your student does have any symptoms in the 14-day window before they arrive to campus, please be sure they seek medical consultation, because when they arrive to campus, we will be asking them if they've had any symptoms in the last 14 days. And if they had to have symptoms, their move-in process might be interrupted. So all the more reason for them to isolate and stay healthy during that 14 days. And if they do have any symptoms arise, to be sure to get medical consultation so that we can clear them quickly once they get to campus, if that's appropriate. We talked about health insurance a little bit. If you're choosing a different health insurance plan for your student, you might want to research which hospitals, urgent cares, and pharmacies are in network with your plan in Portland. That's very helpful because if your student does need care, more care than we can deliver this year on campus, then, and if you want them to stay in network for those benefits, then it's going to be important for them to know, which hospitals, urgent cares, and pharmacies are in network with your insurance plan. Once you come to Portland to help your student move in, I hope that many of you are able to do that. It will be important to help your students set up with a pharmacy in Portland. That's very easy to do. Margaret mentioned a couple of those earlier, about the Safeway and the Fred Meyer on Barber Boulevard are the easiest ones at the campus. And finally, it's important to discuss with your student who their emergency contact will be. We're going to be prompting students to be sure that they have that information on file with the college, just in case anything should happen this year where we should need to reach an emergency contact. And we certainly hope we won't have to do that in any cases, but in any year with 2,000 students on campus, eventually we have to be in touch with an emergency contact about something. So with that, now it's the time for questions. So I will be quiet, and I think, Robin, you're going to be kind of dishing questions out to the panel.
I will, John. Thank you. And thank you to all the panelists for all the information that you provided, as well as all the hard work that you've been doing. Let me start the question and answer period by addressing one thing that has come up a couple of times, and that is Lewis and Clark College planning to open for face-to-face instruction? As of today, right now, that answer is yes. And the entire time over the last several months, all of our plans have been geared toward us being able to open. There have been some questions about, what would happen if you get a case? What if the governor, lots of what ifs that is very difficult for us to answer because those things haven't happened. But there is no indication at this point that the governor is going to not allow us to open. As a matter of fact, all of the Oregon schools, whether private or public right now today, are all planning to be open for face-to-face instruction. So we absolutely are going to do that. The other thing I wanted to say before we get to your questions along the line that John was presenting about what parents can do, one of the things you can really do is to really repeat and talk to your student about the public health messages that Melissa was bringing up, the We Before Me at LC, that this is a community, it has to be a community approach, that if students want to limit the transmission of the virus, they're going to have to make good decisions and they're going to have to be vigilant all the time. And if being at school is important to them, then they're going to have to take responsibility. So we would really appreciate, we're going to be telling them that over and over, but we really would appreciate if you would drill that message home for them. If they want to be here and they want our school to remain open, which we think everyone does, then we all have to do our part. There were various questions about the residence halls. We are planning on having some type of a webinar around that soon, but I thought I would at least address a few of those. One question was, will students living on campus be placed in shared rooms, singles only, or a combination of both? The answer is all of the above. That some of our students who have requested singles will be in singles. The majority of our students will be in doubles. That includes those students who initially had signed up for a quad. Our state and local guidelines will not allow students to live in triples or quads, so we have to de-densify the residence halls. That's the reason why we sent a note to our sophomores, juniors, and seniors and encourage them to consider living off campus if they could, so that we can make sure that we only have students in doubles or singles. And so that is what's holding up the assignment of roommates, which I know is causing great consternation for everybody. I apologize for that. But if we tell you the roommate now, we tell your student the roommate now, then we find out that roommate is actually going to take online classes only, or they're not going to live in the residence halls, then you're going to get a different roommate. So that's the reason why we're waiting to August 7th to make those assignments. And again, I know that that's causing great consternation, but until we know more about who's going to be where, we can't fully assign those rooms. We have a question for Melissa. Melissa, a parent wants to know, will there be any support for students living off campus if they contact COVID?
Yes, the same similar support as on campus, but there's just not the, they'll have to self-isolate in their home, but they can contact my office and the health service to talk about how to do that and to do that safely, and how to minimize risk of exposure to roommates. I can also connect them with academic resources and resources in the community if they need it. So yes, the only difference is we're not going to deliver food for them.
Okay, thank you. And Melissa, another question for you. We've talked about this, but perhaps you could be a little bit more specific about this being an actual requirement. Will LC require that all students wear face masks or face shields?
Yes. 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 It's a state requirement, and it's going to be a requirement of our community as well. And face shields are okay. I think that's our question that people are asking about that. But face shields are definitely okay. But yes, it is required.
Melissa, if I could, Robin, just to jump in, I was just talking with some colleagues on campus earlier today. We're actually looking at I think the strong possibility of making some very small adjustments to the face covering policy. The truth is, face shields are not as effective as face coverings, other face masks, other face coverings in preventing transmission of the illness. So, you know, there are situations where a face shield is going to be appropriate if someone is hard of hearing or deaf and is lip reading, things like that. We're going to absolutely support use of face shields, but we're going to really put the emphasis on other face coverings, which have the research behind them to decrease the transmission of the virus. So just another comment about that.
Thank you, John, for mentioning that. Face shields are, coupled with face coverings, a mask, are better because the stuff from above them, yeah.
Thank you. And I also want to reiterate that everyone in the community will be socially distancing, and when not able to social distance in public areas, when we're going to and from, we will all be wearing some type of face covering as well. Again, that is a requirement that is over and above what the state is actually requiring higher education entities to do. But Lewis and Clark has decided to adopt that. So everyone will be required to socially distance and to use face coverings. We have a lot of questions about travel. So John, I'm wondering if you could make a general statement in regards to how we recommend students handle the flying or driving from out of state. You mentioned this a little bit, but I think it's worth saying again. Related to that, some parents are wondering, well, what about students who, once they get here, are traveling back and forth on campus, back to campus? What will that mean, and what are some of the things that precautions we're putting in place regarding that? You're muted, John.
So sorry, so sorry. I was just visiting the CDC webpage on this again last night. They have a really good webpage, and the link is in the slides that I shared earlier. So you can just go to CDC and look for, basically they have a section for domestic travel, also for international travel, and they break it down by mode of transportation. So whether you're traveling by car, traveling by plane, in truth, a lot of the recommendations are the same recommendations that we're going to be enacting on campus. So maintain your social distance, right? Wear face coverings at all times. Travel with a supply of hand sanitizer, very handy to you, so that you can use hand sanitizer, wash your hands frequently, do all those things that you know many of us have kind of just incorporated into our daily behavior, and then we're going to have student expectations of this fall. So, you know, in a nutshell, those would be the things to do. But I encourage people to visit the CDC website around that. And then in terms of more, you know, local travel around, you know, again, the hand sanitizer. I mean, really, a lot of these recommendations are the same sort of recommendations, right? They're about keeping your distance, you know, whether it's in mass transit or whatnot. Whether using hand sanitizer, washing hands, keeping social distances, these sorts of things. But again, check out the CDC website for the best guidance.
Thanks, John. We had a general question asking for clarity that support staff typically on campus to support student health, academic success, and campus living are not being reduced or limited in any ways in terms of schedules, means of contact, etc. It's a great question. And so starting back in March, when the campus, for all intents and purposes, had to close to face-to-face instruction, 100% of us went, with the exception of Michelle's facility staff, who are deemed as essential workers, and my staff in campus safety, who also are deemed essential frontline workers. Everyone else went to remote work, and we have remained that way since March, late March. And so after that, we developed a telecommuting policy for the campus to make sure that everyone understood what their expectations were for faculty and staff regarding telecommuting. When we start face-to-face instruction, the majority of our faculty, 90% of them at least, will be available for face-to-face. There are some faculty who have health-related issues that will make that difficult, and for those few faculty, we will go through the accommodation process for them. But for the most part, the faculty will be here providing face-to-face instruction. Many of the staff in the student life departments, some of them are represented here, will be in a hybrid situation. If they're able to do more telecommuting work as opposed to face-to-face, they will, especially that first month. But there are some offices, like Margaret's office and the health service and our counseling service will be a mix, but some have to be here in order to do the work that they do. And so we've all submitted our plans. We all know who's going to be here or not, but there will be no reductions in our workforce. What we might see, as Margaret mentioned earlier, and John did as well, is that we've now acclimated to how to provide our services using telemental health, telehealth, and telecommuting. We've gotten relatively good at it. And so we're going to keep using that whenever we possibly can, but there won't be a reduction in the workforce. We had a question for Margaret. The question is the health office considered an urgent care? Our out of insurance only covers urgent care and ER visits. Can my daughter be seen by campus staff and then referred if needed?
Yes, as I mentioned, visits to see us, there is no charge. If there are additional things that need to be done that would incur a charge, we could direct them to where they are in network. But a lot of things we can at least assess and give them guidance without going off campus.
Thank you.
I'll also add on to that, Margaret. I think I heard part of that question, Robin, to be about maybe an insurance policy that only provided for access to urgent care and emergency care. And just a reminder, of course, I'll cover this more in the Friday webinar. So I encourage especially new parents of new students to join that webinar. But if your insurance policy only covers urgent care and emergency care in Portland, we have found that to be insufficient to support the health of our students. So you need to either enroll in our student health insurance plan or find alternative coverage. But that'll focus on more in the webinar on Friday.
Thank you, John. I'm sorry, I lost my question. Michelle, there's a question about shared facilities, and such as restrooms, laundry facilities, those types of things. Folks are wondering how they will be cleaned, what will happen with the trash, how will that be disposed of, will it be treated as biohazard? Can you tell us a little bit about what the janitorial plans will be regarding those shared spaces?
Sure. Basically, they'll be cleaned once a day, sterilized once a day, and probably in the middle of the day, we will have either wipes or a spray bottle with a viricide, so the people going in to use the areas, and there'll be paper towels, can wipe them. The trash will basically be put in a trash unless we believe that there's somebody with an infection. It's pulled out by the custodians every day and put in a general waste dump outside. If we believe there's somebody sick, we would probably treat it as biohazard material. But there was one question, if I could hit an answer. Somebody said, are we going to be certified by the state? That they wanted a yes or no. My understanding is that before we can open, we have to submit a document to the state listing everything we're doing in compliance with it. And that's being drafted up. Our chief of operations is doing that. So the answer to that is yes, everything we're doing will be compliant and will be submitted and reviewed.
And again, I want to emphasize this is where you could be helpful as parents, and this is something we'll be talking with our students about constantly, is that, you know, as Michelle's mentioning, we could do the most deep cleaning you could ever imagine, and we will do COVID-related cleaning as required. But within 5 minutes, if someone touches that and they're actually infected, that cleaning is no longer effective. And there's just no way that we could, you know, continue to have janitorial services clean, you know, 24/7. And so that's why the community is going to have to take some of the responsibility, both the students, the staff, and the faculty. And so we're going to have supplies available, and it'll become a habit. You know, you come into the bathroom, even if you think it's been cleaned, we're going to teach our students, our staff and faculty, wipe that bathroom down, wipe down those handles, use the bathroom, wipe it down again. When you go into a classroom, before you sit in your seat, wipe it down. There'll be things there available for students to be able to do that. At my personal desk, at all of our colleagues' desks, we will have materials there. We'll be wiping down our own desk, washing our hands and doing those things. The whole community will have to take that responsibility. It's really the only way that we can cut down on the virus being on surfaces. We had a question about the residence halls, again, about students hanging out with friends outside of their roommate in the dorms. They're wondering, will they be able to make friends and spend time with other people? What will the policy be regarding students leaving campus, either just to go into Portland or go further away? So one of the things, I actually just taped a video that your student will be watching as part of new student orientation during the week as new student orientation starts. And one of the things I talk to them about is staying in their pod or their posse. And that's different than how we usually talk to students. We usually tell them, go out and make new friends and all that kind of great stuff. I would love to be able to tell students to do that, but it's just not the smartest thing to do. So we're telling students that they should stay in, groups of 4 to 6 students that they know are practicing the same practices that they're doing, that they realize that those students are on the same page and that they're seeing just a small group of people as opposed to hanging out with just anybody just for fall semester. And let's see how that goes. Hopefully we'll be able to expand that more when we start into the spring. But for fall, we're really asking them to limit those social contacts to people that they know, their roommate, and then maybe a couple of other friends. We're gonna ask them to stay on campus. We know that they have to leave for some things, but for the most part, we're gonna really ask them to stay and to really create that bubble that we need. It is just for 3 months. It's not for forever. And it is a doable thing, and it'll really keep them safe. And then the other thing I want to touch on just very briefly as we round out to the end here, I know you've been watching the national news about the unrest in downtown Portland. We are several miles away from downtown Portland. All of this activity is happening in a 2-block radius of downtown Portland. We are definitely going to talk to our students very directly about our advice that they avoid going to the downtown area. We know that they're going to be interested to do so. We understand why they're interested to do so, but we really do not recommend that they do that because of the COVID and possibility of transmission, but also just because it's very uncertain. And so we will be talking with students about that as much as we possibly can. But we encourage you to talk to them about that as well. You could really be helpful in that way. We will be providing you more information as we create and understand what our testing protocols are going to be. As John mentioned, we are actively working with some labs to see if we'll be able to utilize their services by the time school starts. We're relatively confident that we will have that in place. And as soon as we know more about that, we will communicate with all of you. Please talk to your students about the 2-week social isolation, and please keep those questions coming. We will have this available as a recording, and we'll go through each and every one of the questions that we did not get to, and we will begin to answer those questions for you to be able to see them online. If you have further questions, please go to covid19info@lclark.edu, and you can email us your further questions, and we will continue to post the answers to those questions as we know it. I'm sure you have more that you want to hear from us. This is a very, very, very fluid situation. We are taking this very, very seriously, not only for the health of your students, but for the health of all of us as well. And so we know that we need to continue to work on our reopening plans. I think we will be ready. We are very, very hopeful that the campus will open. All indications are that that is the case. And even though it will be different than what it has been in the past, we still think that your student is going to have an excellent experience at Lewis and Clark. So thank you for tuning in. Thank you to the panel for spending time this evening with our parents and our students, and we look forward to talking with you soon. Thank you.